So, welcome everyone. Thanks for coming to this admissions webinar about our Masters of Public Health. I am Anthony Laverty, one of the co-directors, and so actually Henok and Zainab and I were in the same room, but we're all on individually on our laptops. But we'll all introduce ourselves. We're also joined by some of our alumni from previous years. We've got Mara and Sabarna, and so they will be around to answer questions as well, which is great to talk about their experiences. And also, if people do have questions, if you put them in the chat, we can answer those as we go along. But so those are sort of the key details. And you go to the next slide, please. Perfect. And so, yeah, so this is the sort of the running order. So we're going to have a welcome to Imperial and the School of Public Health. Henok is going to talk a bit more specifically about the course, the overview, the content, and then Zainab is going to talk about the project career trajectories. And then, as I say, we will have time for a bit of Q&A at the end. Go to the next slide, please. And so this is us. This is the course team. So Azim Majid, Professor Majid, is the chair, and he's also the chair of the Department of Primary Care and Public Health. So this is me. So Anthony Laverty. I'm an associate professor in public health here, and I work on a range of things, really trying to use sort of routine data to evaluate and inform policy. Joined by Henok. Do you want to introduce yourself?
Hi, everyone. Welcome to the webinar. My name is Henok Taddas. I'm a principal teaching fellow and co-director alongside Anthony. Zainab.
Hi, everyone. I'm Zainab. I'm the course organizer and a senior teaching fellow in public health. Very pleased to be here.
Great. Thanks, Zainab. And do you mind going to the next slide, please, Alex? And also, so we're joined. So behind the scenes, as it were, the program is massively supported by the Education Professional Services team. And so Joe Tite is here on the call and will presumably pick up some of the questions if people have them in the chat. But so Joe, Sylvia and Lauren will look after you very nicely throughout the year. Also, Mara and Sabarna, do you want to just quickly introduce yourselves now? Is that okay?
Hi everyone, I'm Sabarna and I used to be in your shoes and I graduated from the School of Public Health in 2021. So during the pandemic, which was an exciting time to graduate.
Thanks, Sabarna. And Mara?
Hi everyone, I'm Mara. I did this MPH a few years ago. I graduated in 2018. I stayed at Imperial for a few years after, both as a research assistant and doing my PhD before leaving. I'm now in a different country, but it was a wonderful journey. So welcome. I hope you find this helpful and you enjoy this.
Thanks, both. And thanks for joining. We've invited a few other alumni who are hopefully going to join us as well. And do you mind going to the next slide? So I'm just going to, talk a little bit about Imperial, why you should study at Imperial. So I joined Imperial in 2009 as a research assistant. So, there's something, I guess, personally, I sort of believe it's a great place to work and study. So I think this makes it my sort of 17th year at Imperial. And we've got a reasonably new president, Hugh Brady. He joined about 2 years ago, and he has been very keen about focusing, rightly, I think, on this mission of science for humanity. And so, that really speaks well, I think, to, the public health elements that we talk about. And also just, worth saying that Imperial, there are a range of different rankings of universities ranked on different things. There are different metrics. And so we're not going to sort of go into those individually in great detail, but I think it's very fair to say that Imperial is doing extremely well in these UK rankings and in these global rankings. So really, it's a great place, I would say, to work and study. Next slide, please. So just to, I guess, dig down a little bit into that sort of science for humanity framework of thinking about, I guess, trying to motivate everything that we do. There's a very sort of interesting strategy document, and we sort of talk about it, we think about it, but it sort of comes down to these three things, and actually the MPH very specifically speaks to all of these. Firstly, it's around enabling talent, right? And so that is you guys, that is Mara and Sabarna. And so, really we do, having done this for a while, do very much, I guess, have that view that we are, training the next generation of public health leaders, the people who are going to take the field forward. And so, we're enabling talent by giving you the tools and, the ways to categorize things, think about the world that we think are best going to situate you to make these changes in public health. Secondly, it's about powering research. So you will be taught by, if you come, you'll be taught by a wide range of people, and they are all active, they're all research active in their own fields. And that again sort of creates this nice synergy where people, they're doing research, they're experts in the area, and they are also teaching you, and also they're, we're all sort of learning things continuously from students. And thirdly, we've got this real focus on amplifying the impact of the research, the impact of the teaching. And so that comes across in different ways. But I would say that very much Imperial, we're focused on, it is nice to have nice journal papers in, fancy journals that, and that's how the scientific system progresses. But also, it's a real increasing push to actually make sure that these things get out of the lab, out of the School of Public Health building, and are making making an influence, making a positive impact in people, communities, and worldwide. Next slide, please. And so we have a relatively new building. This is our sort of nice picture of our School of Public Health building. So you can see those sort of first two floors are where most of the teaching happens. And I guess I said I wasn't going to talk in great detail about the rankings, but every sort of 7 or 8 years, the UK has this process called the Research Excellence Framework, where they rank universities on the quality and the impact of their research. And so the last one of those was in 2021, and Imperial was ranked first in the UK in this category of public health, health services, and primary care. So really some cutting edge research happening and some cutting edge teaching, which hopefully you would be able to be a part of. And so gonna, before I sort of hand over to Henok to talk a bit about the course details, we also, I guess, as part of this mission to try to connect teaching and research, we do have a number, as Henok will talk about. We have students who go on to publish their own research that comes out of their MPH, and we have, as a sort of School of Public Health, we focus on a wide range of areas. And I think it's fair to say that, the MPH, gives you a taste of lots of different areas, and people can decide, within the MPH, they want to specialize in different areas. And we'll talk about that a bit later. But, there are big research groups, covering most, if not all, of the main areas in public health. These are some of the news headlines relevant recently. What are the trends in non-communicable diseases? What are the environmental factors that are behind poor mental health? International collaboration to try to understand and improve care for these infectious diseases like dengue and Zika, which have been with us for a long time. A lot of environmental epidemiology. What are the cancer risks of nuclear power? Is there something we should be concerned about here? Obviously, lots and lots of COVID work at Imperial, as in lots of other places, and then also a sort of big focus on life course epidemiology. What happens, how can we look at what happens in children and how that influences their lifelong trajectories of health, and crucially, how can we intervene? So a real range of areas being covered. And so I'm going to hand you over to Henok, who is going to talk in a little bit more detail about the course.
Great. Thank you very much, Anthony. And thank you so much, everyone, for being here. Really excited to talk to you about our program. I suspect you'd have looked at our web pages and have the basic understanding of what we provide. But just to recap some of the things, so this is the in-person intensive 1-year on-campus MPH program. We've got a sister course that is completely online and part-time over 2 years. But with us, you get to come to London. Most of the time you'll be at the White City campus, where you'd have opportunities to go and study at the South Kensington and Charing Cross Hospital campus. Imperial is kind of spread out across different campuses in London. And our course is really targeted at people with health background, biomedicine, management, and social science. It's we're very broad in terms of who we recruit into our course, given the nature of our program. Next slide, please. So this is the sister course I was telling you about. It's the Master of Public Health Online. The difference is that it's a 2-year part-time course for targeted at individuals who don't want to quit working and come on a full-time course. So if that's your interest, please go to the online MPH program. The course provision is essentially the same on in most parts. I teach on the online as well as on the on-campus programs. One other differentiating factor is with the online, you could just register for a PG certificate or a PG diploma, whereas for the MPH, you have to be committed to come and undertake the full MPH program when it's the on-campus 1-hour program. Next slide, please. Thank you. And so really the nature of public health is that it's fast evolving, it's changing all the time, it's incorporating different subfields. So we kind of have a broad perspective on how we address public health, from health promotion, health protection, health behavior, health policy, health economics, financing, and so on. So we incorporate the biomedical basis of public health as well as the more broader social, political, economic perspectives. But we want to offer a skills-based, cutting-edge knowledge, and by that we mean really focusing on the quantitative analytical skills that you need to push your careers forward. It doesn't mean we don't cover qualitative skills and social science perspectives, but we aim to give you this strong grounding on statistics, epidemiology, methodologies. And we want to do this by nurturing a creative and supporting learning environment. And I'll try to say what those constitute in a bit. So your year with us will be structured into 3 terms. Your first term, just before coming in the autumn, around October up to Christmas time, will be studying these long modules that we have in epidemiology, statistics, research methods, and the foundational concepts in public health. And then we have a suite of optional and compulsory modules for you to undertake in the second term, in the spring term. And then we've got a whole 4 months from the beginning of May to the end of August dedicated to your independent research, which we call the summer project. And so, yes, so in a nutshell, this is what your year is going to look like. And so you'd undertake this long compulsory modules in the first term. By long, we mean 10 weeks. You'll be engaged in introduction to statistical thinking and data analysis. So Mondays with us are completely focused on that module. In the morning, it's the more theoretical elements and the conceptual aspects of statistics. But then in the afternoons, you're supported by tutors to engage in practical skills development. The same with epidemiological methods, research methods, and the foundations of public health practice. Once you've completed those, you get to choose from around 20 modules to undertake some 5 optional modules that you can select and a further compulsory module in health economics. So you'd undertake another 6 modules in the second term. And depending on your choices with the optional modules and how you combine those, you get to be designated any of these streams. So you could be designated the quantitative method stream depending on your choice, or the environmental health stream. You don't have to take all the modules in that stream. You just need to take at least 3 of the designated modules, and then you can choose the other 2 from the other streams or other modules that you're interested in. So that's our way of trying to cover the broad spectrum of topics that are subsumed within this field that we call public health. And as you can see, the modules span from environmental health, planetary health, commercial determinants of health and health policy, nutritional epidemiology, infectious disease modeling, advanced statistics and data science, and global health innovation and challenge and governance. So you've got quite a selection to choose from and kind of tailor and focus your interests in line with your career interests. And then, as I said, term 3 is completely dedicated for your research project. And yes, of course, the course wouldn't be a course without assessments. And with assessments, we've been quite creative in developing different types of assessments. So you're not going to just be writing essays with us. You're not just going to be undertaking exams, but you'd be engaged in different types of assessment, group work and presentations, video logs, reflective statements, real-life simulations using case studies, and so forth. And all your assessment information will be encapsulated in your module handbooks, which you'll have access to as soon as you get here, and the course assessment schedule as well. So no surprises. You'll have a view of which assessment to take at which time, which should aid your preparation to this towards this assessment. And one thing that we have incorporated into the course is this idea of academic support and guidance through these academic support groups. So we're getting high levels of recruitment nowadays on the Master of Public Health program. So to offer you this small group consultative support mechanism, where you will be attached to one academic within a group of 6 to 8 other students, where you'll be discussing different aspects of support, such as study skills or particular elements of the course that you have difficulty with, and will be getting that close support through this mechanism. And further opportunities that we organize are extracurricular engagements through study-led seminars, departmental level seminars. So we've got a number of departments that make up the School of Public Health department. That's a department as well, but it has sub-departments like the Department of Infectious Disease Epidemiology, the Epidemiology and Biostatistics Department, the Public Health and Primary Care Department, the Aging Research Unit, the George Institute for Global Health Research, and other research groups. So they organize periodic seminars, which will be made available to you to take part in. And we've got this Imperial Graduate School. The name has changed recently across the college, but those the seminars that they organize will be available to you as well. And of course, there will be, as I said, this optional academic support and career sessions. And since recently, we've founded this student forum. we've molded this to be student-led with the support of our staff members. So you'd be organizing different career talks and career sessions in line with the interests of your cohort. Slide, please. And you probably know about this already. Another really defining aspect of our course has been over the last years, we've been organizing this annual visits to the WHO and other agencies in Geneva. We've added an additional destination to this with the WHO Academy in Lyon. This is a new in France, Lyon, and this is a newly established WHO center. We introduced this last year and it was such a hit with the students. These trips are really, really highly appraised by our students. So you go for about up to 3 days to be immersed in some of the processes with this international agency. So it's not just a walk through and visit, but you have seminars there. You get the opportunity to talk to different experts working with these institutions. This is facilitated by our Imperial is one of the WHO's collaborating centers for teaching and education. And so this is facilitated by Professor Salman Rauf, who's the director of, and his team, who's the director of the WHO Collaborating Center at Imperial. Yes, and over to you, Zainab. Thank you.
Hi, everyone. Yeah, a very warm welcome for me. So I'm going to go through the dissertation, the research project part of the program with you. So that takes place in term 3, but we start preparing you for that from the get-go, really, from term 1, where you focus on the foundational methodology that will lead you to doing your own independent research. So in term 1, as I say, you focus on your research methods, on how to come up with a research question, on how to do statistics, on the basic foundational epidemiology, how to engage with literature. And as part of your research methods module, you do learn how you come up with your own research question. And then in early term 2, we start the project selection process. So the supervisors are from the School of Public Health, across the whole School of Public Health. And as Henrik said, there are many, many different research departments, and within this, many more research groups. So pretty much any topic that you can think of related to public health, there will be research taking place on that topic. So we really encourage you to also pursue research in an area that you're interested in, and we'll support you in developing your own research proposal if you want to do that. But if you don't want to do that, there are supervisors across the School of Public Health submit a very, very large list of projects, so you have a big pool of research projects to choose from. So I've just finished helping many students develop their own research projects. I think this year we have around 12 students that have developed their own independent research project, and one supervisor can be external to Imperial. So some of these projects also are in collaboration with external partners. It can also be with collaboration with partners from Imperial that are not within the School of Public Health. So what we do is we release the project. So you get to pick 3 choices from that project list, and then you go through a selection process whereby you will submit your CVs, and supervisors might want to interview you for the project, and then make sure that you're the best fit for the project according to your interests. And we provide support and guide you through this process. So in term 3, we'll begin the research project in early May. And at the start of June, we have a check-in presentation where we make sure that you're on the right track, that you've developed your research project, you've done some background reading, and then throughout June and July, you really work in depth on your research project, gathering data or doing data analysis. I'll give you some titles in a bit so you can see the types of research projects that are done. And then you submit a 5,000 to 7,000 word written dissertation towards the end of August. And then early September, you have a Viva, which is a presentation where we ask you, we present your research project and we ask you some questions. So that's a sort of outline of how the process works and what the summer term will look like. Alongside that, we have summer support sessions. So where these are in person and they very much support your research project journey. And these are run by the faculty. But on top of that, you have your meetings with your research supervisors. Quite often, this is more than, can be 2 supervisors, sometimes it's more, and they'll meet you every week or every 2 weeks and provide really hands-on guidance and support throughout the research project period. So it really is an authentic research experience where you're embedded within a research team, within a department, and many students really use this as a networking opportunity, and a lot of students go on to do jobs related to their research project or even a PhD. So these are examples of previous research projects, and they're in a range of different methodologies that you will learn about on the course before you get to the research project period. So that it can be systematic reviews, which, as I say, you learn all about how to do systematic reviews on the research methods module. It can be primary data collection, which is quite challenging within the 4-month time frame you have, but many students do primary data collection. There's every year there's a few qualitative projects. Or we have a huge amount of secondary data available through staff for you to analyze. So a lot of projects are secondary data analysis. So those are the sort of different methodologies. But as you can see, there's also a very wide range of topics that are covered. So we have a very large group looking at nutrition policy, ultra-processed foods and obesity. So a lot of projects are offered on this topic. We have another group working on health innovation. So we have a lot of projects on this. And then we have a very large group on tobacco control policies, on tobacco control research. So we have quite a lot of projects on this topic as well. And then there's a large environmental epidemiology unit and a large aging unit. So these always provide a lot of projects as well. So I hope that gives you a good idea of the scope of the research projects. And then many projects also go on to publication. It does take time, but supervisors are very much support this, and many students get in touch once they've finished the dissertation to develop their project into a publication. So these are just examples of some previous projects that have been published. This one is about access to primary care and visits to emergency departments, and it was published in +1. And Matthew Harris was the supervisor of this one. And then here we've got a systematic review and meta-analysis related to blood pressure, hypertension, and the risk of sudden cardiac death, published in the European Journal of Epidemiology. And here's one appendix, I think, a qualitative research project looking at community-based interventions for improving mental health in refugee children and adolescents in high-income countries. And then this is a tobacco one, a survey analysis of survey data published in the Journal of Adolescent Health. And this one, I think, another qualitative one, another one of appendix looking at male involvement in reproductive, maternal, newborn, and child health, published in Reproductive Health. So hopefully that gives you a good idea of the independent research project that you will be able to do. And it's really important because it's really putting into practice everything that you've learned in term 1 and 2. It's really applying everything that you have learned across the course. And we find that students find there to be a real uptick in their skills and their abilities once they've actually applied everything that they've learned during the research project period. And then so talk a little bit about careers. As the public health, as you know, is quite wide, covering a range of topics, the range of roles and employers is also quite wide. And we have people going on to work in academia, in management and consultancy. Many go on to work in government departments, such as the UK HSA or similar ones within their own countries. We have a lot of clinicians that come on the course, so they can go back to being a physician or a public health registrar. And the range of employers also, as I said, can really range and is very wide. And if you do a quick search on LinkedIn, looking at MPH, Imperial, if you just type that in, you can see that there's a really, really big wide range of roles that our alumni do. These are just some: analyst, researcher, public health officer. Many are policy managers, advisors, or coordinators. Some are clinicians, and many do go on to do a PhD as well. And these are some of the job titles. So we have an alumni that is healthcare strategy monitor at Deloitte. We have another person that is a consultant at PricewaterhouseCoopers in the Middle East. These are just some of the jobs that people are doing in academia: researcher, clinical trial manager, or project manager. And then within government public health organizations, this could be NIHR, the UK HSA, and all local public health departments. For example, one of our alumni is an infectious disease modeler at UK HSA. We have quite a few alumni working at UK HSA, actually. And then other NGOs, think tanks, examples of Policy Connect for the World Obesity Federation. And as part of our career support, we have many speakers coming from a lot of these backgrounds that come in and speak to you about their career journey, including alumni. And these are some of the career support that you can access. So Imperial have a really good career service that you can access for one-to-one appointments, but also we have as I said, within the School of Public Health, there are career sessions organised. So that's just another little bit on the career support that the Imperial Career Service offers. And there are some really, really good resources available that are called Attributes and Aspiration courses, which students find really great. So once you enter, you can access all these courses. There's no shortage of really opportunities, seminars, and support services really available at Imperial that you can access once you join. And then finally, to finish, there's some suggested summer reading for you all to do before you join the course. But I'm very happy to take questions on any of this. Thank you, everyone.
Great. Thank you very much, Zainab. I'd really like to get Mara, Subarna, and I see Yoshiko is here, and Ahmed as well. So welcome, everyone. I'd really like to give you some opportunity to reflect on how you found the MPH and how it's potentially supported your career so far and your career. I think our attendees will be really interested in seeing your trajectory. So it's going to be a lot of things to cover, but within 2 minutes each, if you could reflect on your MPH journey and your careers, that'd be great. So, Mara?
Sure. Thanks, Hanok, for inviting me to this and giving me the opportunity to speak. As you were going through all this presentation, it reminded me of such good times. As I said earlier, I did this master's quite a while ago, but I have such fond memories of it. I think one of the main things I really wanted to mention, and I see you still have more of that now, is the diversity of modules. So with your MPH, you can really go any which way that you want to go. And to me, this was wonderful. It really allowed me to kind of discover new things. So when I started, I thought I had an idea of where I wanted to go, but with this diversity, I could really hone in on the things that I like the most. I have to say I had a really amazing class as well. Very interesting discussions, very interesting assessments. With the Geneva trip also, so I ended up doing my master's research project partly with primary data collection from that Geneva trip. So that was kind of combined. And then I went on to stay with my supervisors from my master's into a research assistant job and then a PhD. So I think in terms of network, it really kind of gave me the next steps in my career. I am now in a completely different continent and country. I work for an NGO in malaria, so it's still to do with public health. And I think this was very much a stepping stone to getting me here in slightly different ways. One thing I want to say also that I really appreciated, and maybe that wasn't mentioned so much, is the fact that this master's is in London just gives you so many opportunities. There's so much going on all the time. And beyond the network of amazing other students that you have, amazing lecturers and people that you can speak to, there's a lot of events that you can go or partake in. And I found that really created my network, but opened up my horizons. I moved to London for the master's, and then I ended up staying 7 years before moving. So yeah, I hope I'm within the 2 minutes, but yeah, it was a wonderful, wonderful experience. And so good luck. applying to it.
Thank you so much, Mara. Just one more question. So what was your background coming into the MPH, Mara? There were some questions in the chat.
Yes, so I had done a biomedical undergraduate, biomedical sciences, with a specialization in infectious diseases. And then I did, during my MPH, I took the global health stream, which is not quite what it looks like nowadays that I could see from the modules. And then my PhD was in infectious disease modeling, so very quantitative, kind of staying within the broad track. But the MPH kind of gave me a stepping stone to get into something more quantitative because I didn't really have that background before.
Fantastic. Thank you. Thank you, Mara. Over to you, Subarna.
Thanks, Anok, and thanks again for giving me the opportunity to have this conversation with all the prospective students who will be soon in the School of Public Health. So, as to just give you all a quick background, I graduated in 2021, which, like I said, was during the peak pandemic, and that just made me realize how important public health really is. And to add on, I transitioned from engineering where I specialized in bioinformatics, but then I realized that public health was my true calling. And since then, my career has taken a path that connects public health data and environmental impact in ways that I didn't fully expect when I started. So, my MPH gave me a very strong understanding of epidemiology, data interpretation, and systems thinking. For instance, my MPH thesis was very, very, very heavy on quantitative research methods, where I still remember doing a time series based regression model. And to this day, it just makes me realize how problem solving can be delivered at scale. And upon graduating, like I said, it leads you to so many unexpected paths, as very clearly highlighted by Zainab. Um, and I basically transitioned to consulting, and it was basically a crash course in solving so many problems and working on very, very, very innovative projects in the big pharma sector, where I translated industry insights and took all the complex data and gave recommendations to clients. And the MPH prepares you for that because it brings policy, systems thinking, data analysis interpretation, and really makes sure that you deliver at scale. And now I also communicate those findings because I have transitioned to the role of a product manager, where I again would think, does that sound like a public health degree or like a public health career immediately? Perhaps not. But when you tie that to what I currently do, where I integrate waste data systems into how that translates into environmental health outcomes, whether that's looking at pollution, looking at exposure risks, or community inequity and climate impacts, it really allows you to think that, yes, this is how public health, at the end of the day, allows you to tie multiple aspects into a beautiful outcome that you feel that you are helping people at the bigger community level, really. So let's put it this way. For me, public health professionals will always help you understand systems, their preventions, and looking at long term impact. And in my case, waste touches all three. So, like I said, I think my lessons was that don't be ever afraid to charter into non-traditional paths, because at the end of the day, public health voices genuinely matter, and in more recent times it has only made me realize, and probably everyone realize, that our voices are very strong, and impact can be direct or indirect, but as long as it's meaningful. And I'm very grateful for everything that I learned at the MPH. And even on a personal level, two of my closest friends are from my cohort. And so, from a professional level, I love my job and I love what I do. And from a personal level, also, I'm winning because I have such a wonderful network of people who have who I would have not otherwise met had it not been for the MPH.
Fantastic. Thank you, Suparna. And if we have converted Suparna from a technology background to a public health enthusiast, guys, I think that's brilliant. What was your undergraduate in again, Suparna?
I pursued an engineering degree and specialized in bioinformatics.
Parna did her engineering degree in one of the top engineering schools in India, came to us and completed the MPhil. So great, fantastic. Thank you, Suparna.
Thank you.
And over to Yoshiko, who I remember has done her project in a slightly different area, primary data collection, mixed methods, who I had the privilege to be part of and publish together. But Yoshiko, over to you.
Thank you so much, Hanox. It's always great to see the familiar face here. So I'm Yoshiko. So I'm originally from Japan, but like by the way of my background, so I'm trained physiotherapist in Japan. Before joining MEPH, I was 100% of the clinical person, so I had no ideas about MPH and I had no experiences on the research. But I am now a research fellow and also a PhD candidate at the London School of Hygiene and Tropical Medicine. So actually, so the program itself prepared me very well for pursuing the careers in the public health. I would say in particular, so as Hannah that mentioned that right now, I did my primary collections in the collaborations with the Imperial Clinical Trials Unit. Like actually that work was feeding into the national guidelines, how we could improve the inclusions of the people with disabilities in the national settings. And I'm still working and still collaborating with them. So I think it's always very great to have the very great colleagues like who are working with. And then for sure, I would say the doing the MPH at Imperial was the like biggest turning point in my life because of the like before the MPH, because of I didn't think how much I am now rubbing the to doing the research. So yeah, like doing the masters and also doing the like primary data corrections or whatever you are really interested in, the topics for your master dissertation, that could be strengthen your CV, of course. And also, yeah, it's expand your horizon too. Yeah, so that's some observations from me. Yeah.
Great. Thank you so much, Yoshiko. And Yoshiko has developed her own voice in that space. And if you follow her like me on LinkedIn, she's sharing a lot of her own research outputs and others. So please do follow her. Thank you, Yoshiko. Over to Ahmad. Welcome, Ahmad.
Hello, hi Hannah. Thank you so much for inviting me, and thanks everyone. So I'm not sure what to add actually to all these amazing stories. So I think I'll share just my main two thinking when I joined the MKH. So I finished my MKH in 2017-18. I was lucky to be in the same cohort with Mara. I think our cohort, I still vote for it as the best, but so I think the main two worry I wanted to share is just before joining the course, the worry of will I really fit into MPH at Imperial College? My background was clinical, so I finished medical school in Egypt and then I worked with the UNHCR as emergency doctor, mainly in war zones. So I didn't have any idea about research or anything like that at all. And I remember very well when I joined the MPH, the very first I think it was not like a formal assessment. It was like informal assessment. I got the worst score ever. I think they just passed me with, I don't know, like 50% or something. I had a meeting with Henneken that day. I was like, just are you sure you can keep going? Yeah, let's hope so. And then I mean it, the cohort and the support you will get at the MPH at Imperial is impressive. It can prepare you actually from whatever level you are, and then it can push you forward. So that's something I was worried about, and I got reassured when I joined the course. And again, it is not only when they present anyone when they present to you as support, any college, including Imperial College, can keep saying, "Oh, we offer one, two, three, four, five," but actually the major support that you will get is from your own cohort. And Imperial, the MPH at Imperial has been always amazing in gathering too many diverse students and professionals to study the MPH together. So you will get amazing support from that cohort, more than you can imagine. And then the second worry, I wanted something, MPH, to open for me doors out of the UK as well, just to control my future, let's say. Especially, I joined the MPH supported by Achieving Scholarship. So, as part of that scholarship, I can't stay in the UK after finishing my MPH. So, I want a degree that opened for me doors. And I will not mention names of other universities, but to apply for this scholarship and to apply for the MPH itself, I applied for 11 universities in the UK for the MPH. I got offers from all of them, and I had to choose an Imperial based on recommendations, and I think it was the best choice I have made. So after the MPH, I managed to get 3 offers for PhDs, one in Germany, Austria, and Spain. That was with support with my supervisor, Felipus Philippidis. You will meet him if you join the MPH, and also my cohort. And I also get one offer in MSF, but I didn't get it, and yeah, I didn't choose to go for it because it was again field work. And eventually, after the MPH directly, I chose to go for WHO. So I worked with WHO for 2 years as full time. And then after finishing with WHO, I still do some short-term consultancies with them. But again, MPH qualified me to do other things as well. So when I finished with WHO, and then I joined again research with Imperial College as research associate, and then I joined University of Cambridge in academic clinical fellowship and doing some part-time clinical work back again. And at the moment, I'm doing clinical research fellowship at Imperial College London in the Institute of Global Health Innovation, and I do part-time clinical work at St. Mary Hospital, and yeah, still some short-term consultancies as a side. So again, Imperial can open for you many, many doors through the network and the support you will get, and also the amazing cohort you should expect if you joined. Thank you.
Fantastic. Thank you so much, Ahmed. And I saw on LinkedIn recently that you won the Best Presentation Award in some conference. Do you want to say that?
Oh, yeah, thank you. I think, yeah, it was just a simple conference, but it was quite good. Yeah, it's just the best early career researcher award. It was quite good. Yeah, it was encouraging because it's part of my PhD, but also again also about the development inside Imperial, because my main work at the moment is focusing on AI in primary care. Despite, again, if you remember what I said in my very beginning background, I was just in clinical work in emergency settings. So like now shifting into AI and that kind of advancement, it's a big deal for me. So yeah.
Really fantastic to hear. Thank you so much, Ahmed. Great. Thank you so much, all. We've got some questions in there, and we might field some of them to you guys, or there might be some. I know Anthony has been responding to those, Zainab as well. I know Joe and Sylvia have been in the background. We've got around 50 questions that have already been answered in this process. But there's one that I want to pick up here. I remember in my application, Sylvia wanted me to emphasize my statement regarding quantitative skills. Can you tell me more about the quantitative modules and how the teaching method is there and how the students can explore more into that? Okay, so we do emphasize the quantitative methods in the sense that if you don't have any quantitative background, it'll be difficult for you to deal with our modules. But that does not mean that we expect you to have done those modules before, right? The module starts from a very basic level, of course, going on to the more advanced concepts as well. So what we have are, principles and methods of epidemiology and statistical methods. So biostatistics, a basic biostatistics course in the first term. The other more advanced quantitative methodologies, infectious disease modeling and advanced stats, you would only do them if you chose to go down that track in the second term, right? What you need is enough demonstration of your skills, your experience with quantitative skills to be admitted into the program, right? So this can be demonstrated through some statistics module you've taken in your undergraduate. Some students haven't done that, so they opt to enroll on one of these short courses, online short courses, and undertake that and send us the certificates as evidence that they are happy to work with statistical methods. Or for other cases, we've even looked at their high school diplomas to say that they've done well in math. So we're not really requiring that you come to us as experts in this, because That's not the expectation at all. We want to teach at different levels starting from the basic level, and it's all very much supported throughout the day. So our modules are organized around single days. So statistics, you do them on Mondays. Epidemiology on Tuesdays. So you do your conceptual new concepts that you learn in the morning, and the afternoon is dedicated for actual tutor-supported tutorials where you actually try out the skills of working out what you learned during the morning, but also what we have is this flipped classroom approach where you would undertake a lot of the learning online on your own time and come into the classroom for more interactive sessions. I hope that explains some of those questions within that one question. It was so hopefully that was useful. Any other question you want to pick up? Maybe from something you've already responded to.
No, we've had a few questions about scholarships, and so they're sort of all on all the information about that is on the webpage. I mean, so do be proactive about looking there. And and then a few, I think most of the questions we've been answered. I mean, there's some quite specific questions about what should people do? But I mean, I think, we see, and I guess the alumni here speak to it nicely, that, people are using the FPH to do a great range of things. But I think that's it for me.
So there's one that's just come in around, is work experience preferred before the MPH or right after undergraduate? Is possible. So our students demonstrate that in different ways. So you can look at the entry requirements, a 2-1 equivalent UK degree or above. That's a key requirement. And beyond that, we want you to demonstrate that you've had this career plan in public health demonstrated through either internships and placements during your undergraduate degree. A number of our students have done that. So you don't have to have this massive experience necessarily, but other students have had that, considerable experience after completing their undergraduate. So it all can be done in different ways. And we've got another question. Hello, I'm an applicant from Ethiopia. I have a Doctor of Medicine, but I do not have a separate master's degree. Since the requirements mention a bachelor's and a master's for Ethiopian applicants, would an MD degree be considered sufficient for applying to a master's program at Imperial, or would I still need a separate master's qualification? You would not need a separate master's qualification at all. We will review each application on its own merits. We will try to see the statement of purpose is quite important for us. So we'll be reviewing an honest reflection of how you've come to what we want to make sure is on both ends. Are you the right student for our course, but also is our course the right course for the applicant? So we want to make sure that you've had this motivation to study public health, which again, as I said, can be demonstrated. So you might be having a clinical job mainly, but have you drawn out the public health implications of your work, and have you been involved in those aspects in different forms? So we will be trying to determine that from your statement of purpose, from your CV and so forth. So the email has been displayed, the queries, MPH queries email. So you could email us through that, and the team will channel to the right person to answer your queries. Any other thing?
No, I don't think so. I think that's covered all of the questions. Unless people have any sort of last minute questions, this is the time to get them in. Someone's asked for when you pick your optional modules. So you pick your optional modules around about halfway through the first term. So I have this first term, it's 10 weeks long. So we give you a chance to settle in, and that we have quite a structured process. We sort of talk to you about what the streams involve. Module leaders will come and talk to you about specifically what's in their module, and so then you would choose that. So we would talk to you about that sort of halfway through that first term. And I can see some questions are arriving at the last moment. So with scholarships, there's a range of different scholarships to cover different amounts. So if you look at the web page, that covers that. And then statistically, what is the percentage of acceptance? I'm not sure. I know
25%, I would say, but that doesn't mean that you're competing with other applicants. You're looked at on the merits of your own application, right? So we don't do, how does this applicant compete to the other applicants, where it's a rolling basis. So please do submit your application as soon as possible for you, and then it will be reviewed on its own merit. And as long as you make those basic criteria, your statement of purpose is well aligned. We do implement some interviews depending on the reviewed application, if we have certain things to clarify through an interview, but otherwise, decisions are made on the merits of the applications you've submitted. Got a couple of minutes. If there are any late breaker questions, we can try and answer. But otherwise, it's been a really, really nice, great to hear from all of you. We had around 61 questions which have been answered through the chat, and some of them are discussed here. We are ever so grateful for our alumni, Subarna, Yoshiko, Mara, and Ahmed. Thank you so much for joining us today. And thank you very much, team.
Yes.
I think that's a wrap.
Thanks, everyone. We look forward to seeing you in interviews or in October.
Yeah, I really look forward to seeing you all.
Cheers. Thank you.
Thanks, everyone.
Bye.
Thank you. Bye.